Hi everyone, this is Kate Warnock coming to you from the Guidewell UST Global Innovation Center in Lake Nona. I am delighted to bring a guest here to the studio. His name is Matthew Holt. Matthew, welcome to the interview.
Kate, thank you.
Matthew is the co-chairman of Health 2.0. Let's start there with Health 2.0. Can you tell us a little bit about the company and the conference that you're about to host? I wonder if there might be any parallels between the conversations there and the conversations you might be hosting there.
Sure. So Health 2.0, which is a conference that Indu Sabaya and I started 10 years ago. It's our 10th year.
Congratulations.
This year, which is
That's
amazing.
Amazing
you can do anything. It's like being married, right? The two of us have been doing this for 10 years. Now we have 15 people and we're working away. But the main thing we're known for is a large conference, which is the sort of Silicon Valley Health Technology Conference, and that happens every late September or early October. This year, September the 25th through 28th, plug.
Excellent.
In Santa Clara, California, right next door to the 49ers Stadium, where the victorious 49ers, well, they haven't won a game in a few years, but one day they'll win a game again and they'll be playing there. So that conference is all about the very latest in health technology, and I call this SMAC Health, which is S for social and sensors, M for mobile, A for analytics, C for cloud, and I add a K for kindness or empathy, which is something that did come up at the conference a lot today. So all those new tools, we're not talking here about old style electronic medical records or client server technology, we're talking about the new tools predominantly being used by consumers, use them every day when you take up your iPhone or your iPad or when you use Facebook or any of the online services that Google. That's the world that's slowly coming into healthcare. Mm-hmm. And I think the parallels, and we run a conference where we show something like 120 live demos and we really focus on that technology. But we also introduce those sort of Silicon Valley tech companies to the major healthcare players, particularly large health plans, large provider organizations. We're talking about UPMC from Pittsburgh and Cedars-Sinai and Stanford and Kaiser Permanente, those kinds of guys. And we have a few international folks coming as well from Finland and Norway and Holland and elsewhere. What we're really trying to do is sort of to get the cutting edge innovation players within the healthcare enterprises to meet these new players and sort of integrate them together. So that's a lot of the conversation we've heard here today about cancer at the Guidewell Center, about greater than cancer, has been about what do cancer patients in particular, but also providers, working in oncology, what do they need? And a lot of what they need is the kind of stuff that happens at Health 2.0.
Right.
Now, having said that, the format here is incredibly different. This is a conversational roundtable. Health 2.0 has lots of conversations, but has a lot of technology demos. There are 150, 200 people here talking intently. We have 2,000 people.
Right.
It's not the same. It's a different type of event.
Right.
But I think both are very, very important. And the last thing I'd say is that what I've heard a lot that is clearly missing today from the patients, we had some really wonderful and emotional talks today from cancer survivors, was that what they were missing was the ability to be consumers, to manage their experience using the consumer tools they use everywhere else. And some of them are now developing them, such as Rallyhood, which we're talking about today. Mm-hmm. So I think, it's wonderful to be here because you're getting that contrast.
Excellent. Well, you are known, especially in social media, for asking some provocative questions and really not letting conversations be ignored.
I thought I was known for talking rubbish online, but that's a very polite way of saying it.
Well, I want to know from you, having participated in the first day of this event, what conversations deserve some more airtime, in your opinion?
Well, so I think I would say, where is the leadership coming from to fix the problems that we've heard about?
You asked that of American Cancer Society, didn't you?
So the American Cancer Society is a good example, and I kind of joked in one of the great things about today's session was there were these breakout sessions where you get to plan, and I had some colleagues from the American Cancer Society in my little group, and I was saying, okay, great, now you're the CEO of this new business we're having because there needs to be a new business. And what's clear that in cancer, things are slightly different than they are in other diseases. So in many disease states, we kind of understand that if we can do slow changes to preventative care, get people before they overeat and don't exercise and
right.
make behavior changes and modifications or adjust them when they have a chronic disease like diabetes or congestive heart failure. We can do something about it and prevent big flare-ups and problems using a lot of tools and using behavior change techniques and that kind of stuff. We don't do it, but we understand we can do it.
Right.
In cancer, you go from being healthy. I mean, think about the people we had today, Patty and Jean, I'm blanking on her name, from Marin County. I think it's Jean. We may have to edit that part out, but anyway. They went from being completely and unbelievably healthy, running 7 miles, to the next day being diagnosed, having a great fun birthday party and having breast cancer and double mastectomies, and very quickly. So they went from being incredibly healthy to being incredibly sick very quickly, and it's a big question as to whether there's something you can do about the prevention part. But what you can certainly do, and this is where I was thinking that we need leadership, is there is so much uncertainty about what happens in oncology treatment. Surgery, radiation, chemotherapy, other types of treatments and follow-up. There's some good data, but not enough understanding of that data about the implications both of the sort of what the morbidity and mortality effects are of those treatments and the impact on morbidity and mortality rather than the effects, but also what the side effects are and what the experience of those patients are, and that people don't understand that, and they tend to get pushed through the cancer system by their oncologists or by their centers. And you heard a lot of complaints about that part today. The other thing you heard a lot of complaints about was the system, my provider, didn't care about the stuff that actually mattered to me, which was, dealing with my kids, dealing with the fact that I was too sick to get out of bed or whatever, because of the treatment, and that was impacting on my home life and, heaven forbid I wanted to have sex with my husband, etc. All that stuff. Right. So there is a big, big opportunity to get together, whether it's one central organization or many working together. How can we put together some kind of patient-focused concierge advocacy organization that takes all that data, is like right at the heart of understanding what's going on in all those different cancer treatments and clinical trials. It's got the data, it's doing all that kind of good stuff on the provider side, and it's translating that for patients and being their independent advocate. The American Cancer Society is doing that in kind of the money side and helping people through that. And they do have an advocacy organization which has 1 million calls a year, which is, not bad, but what do we say, 15 million people are living with cancer?
Oh, even more, yeah.
Maybe more.
Yeah.
So the answer in the US alone. So the answer is somebody should be, there should be somebody who's getting 100 million calls. I don't know, or 100 million touches, or, their AI avatar should be working, whatever it happens to be. You're seeing a lot of these tools out there, but they're not being centralized by somebody with a big consumer reach. And I think, there's lots of great stuff happening from small tech companies. We've shown a lot about Health 2.0, there was some here, we heard about Rally Round and some others. But what we have not seen has been an organization, whether it's American Cancer Society or somebody else, who's taken this on and put together the huge coalition that will fix this problem. And cancer is a special case, and I think, that's why I think, maybe it's unfair to throw rocks at them, but, which I did today a little bit. That was quite nice. It was a nice rock throw. I threw gentle. Those rocks made of polystyrene that bounce off, not one's actual rocks.
Right.
But I do believe that we can do better.
It's certainly an opportunity, isn't it? So hopefully someone identifies and really does help to lead more people in that direction, because obviously it's missing from today's society. So,
well, let me say one more thing.
Okay.
In chronic care management, you're starting to see the emergence of primary care plus chronic care focused organizations like Iora Health or Q Alliance, who are starting to figure out how do you manage people with diabetes in a different way than primary care has typically been done. We've yet to see that kind of equivalent group emerging in cancer, and I think it's because there's too much uncertainty in treatments, and somebody has to be the advocate of the consumer. And from my conversations today and hearing the presentations today, ain't no one doing that quite yet.
So great call to action, and obviously anybody watching this, big business opportunity as well.
I hope so. I don't know if it's a business opportunity or whether it's a
right thing to do opportunity.
Right thing to do, non-profit, whatever.
Right.
But, and that's something else we got into heavily, not so much in the main presentations today, but in the discussions, in the side rooms, which is incredibly valuable and a lot of fun, by the way, those of you who are not here, what we did find was a lot of conversations about, okay, if we can get people to understand more about their care, it's likely that they'll opt for less aggressive treatments. We'll have sort of what I call, less, excessively futile care of the nearly dead, and look more at palliative care opportunities in hospice and that kind of stuff. And it'll probably be a better outcome for not only for the patients, but for the system, and it'll probably cost less money. So there's probably an opportunity to save money by thinking about the way we deliver care in a more rational way, as long as the patients are bought in, and to do through patient choice in mind as well. So you can argue back and forth, but clearly what we're doing now, there are lots of bright spots in the cancer world, but a lot of what we're doing now isn't working.
Well, Matthew, I have one more question for you, and it's going to go back to part of a response that you were giving, and even really the focus and objective of Health 2.0. It's easy for large legacy systems to get a seat at the table, maybe less so for a startup. How is it that we can get more startups, more of the entrepreneurs involved in helping to solve for the cancer experience?
The issue, I think, is that most startups, there are a number aiming at cancer, a lot of other startups aiming at all kinds of other conditions. Most of them are interested in trying to figure out how do they get that first rung on the ladder, and usually they have to connect with a big cancer center or some, they need a customer. So I think probably the way to do that is to think about more how can you do a bit of bridging between potential customers and potential startups, and doing more of the invitations around it. You've got some here,
right?
Some very interesting companies are here, but the question is, at what point do you want to make that a bit more of the focus of the conference than the sort of open discussion part? Now, people from startups are smart, they're usually passionate and care, they want to engage in the discussion around this, but it's also, they also have got a very definitive need, because in a startup, if you're going to come in and do something innovative, you've got to do it in 1, 2, 3 years, or else you're doing something else soon.
Right.
So, the question is, should a guy or whomever be putting a bit more of a structure around that? And so at Health 2.0, we actually do that. To blow our trumpet, our non-conference business, and actually a little bit at our conference too, is structured meetings which lead to pilots between small tech companies and larger providers typically, but not necessarily providers, could be community organizations or Medicaid plans or whatever else. And what we've found is that that's a very good way for us as a business to keep in contact with all those different small tech startups, because they have a need to tell the world what they're doing at a conference, but they also have a need to meet these people and to do business. Right. And conversely, the big guys who have the seat at the table now, they need that innovation from the small guys to actually change as well. And it's in some ways in Silicon Valley, it's now called the unicorn hedge. You're a huge company, you buy a startup, maybe a unicorn already, may not be a unicorn. You buy that to incorporate their technology, and because they may be the people who would put you out of business if they got it right. So maybe you work with them. And we're starting to see a lot of that in healthcare. You're seeing a lot of hospitals now have somebody called a CIO, who's no longer the chief information officer, but is now the chief innovation officer. Right. And they're starting to put together groups which include venture funds and pilot programs, and they're starting to put together new types of services. And I think that is that's a leading indicator that stable, boring, old staid healthcare is kind of getting that it's got to get on this wave, and it's kind of getting there. So I'm actually, in general, I've been doing this more than 20 years now. I'm much more optimistic now than I was when I started, that this stuff might actually get into healthcare and change it.
Well, I think it's a very exciting time to be in the health industry, because there are people like yourself who are really getting traction and getting the right people to attend those conferences and participate in events like ours. So I want to thank you so much for giving us your time, Matthew Holt. My name is Kate Warnock. Thank you so much for watching.